to the Nightcap. It's your girl, Carolina Sanchez, and tonight we're getting real, baby. As y'all know, we all like to look good, baby. We like our procedures. We want the Botox. We want to be snatched. But sometimes things can be too good to be true, or they can go terribly wrong. So tonight, we have somebody who's sharing their story about a botched cool sculpting experience. And joining her, we've got a wonderful social media influencer who is all about the plastic surgery, skincare, pop culture, and she is critiquing it with a lot of sass, baby. And guess what? They're here. So let's get into it.
Yeah, what's up for a nightcap? Chill, you know, kick back.
All right, let's talk about these procedures and what to do, what not to do, and our regrets and our great decisions. All right, we've got Jordan Boyd here for the very first time. Welcome, welcome.
Thank you.
Sitting next to you, we've got Dana Omari Harrell. Thanks for being here. All right, cheers, because you came on your birthday.
It's my birthday.
I know. Talking about botched plastic surgery probably wasn't on the plans, but you're going to go out and have a good time.
Yeah.
All right, Jordan, I'm told that you have quite a journey that people can, learn a thing or two from. So what's your experience?
Okay, so back in 2020, I got cool sculpting done, which was a new procedure to me. I had just looked it up. I was getting ads on my Instagram, all of that kind of stuff. And at the time, I was in a really good shape. I just was having trouble with like lower abdominal and arms, which I feel like a lot of women
right here
with.
Preach,
exactly.
Preach.
But I'm like, I'm working out, I'm eating right, I'm limiting my alcohol. What else could I do to get this like body that I wanted? So I went with cool sculpting, and unfortunately, I just don't feel like it worked for me. I ended up gaining weight during COVID, and as I was gaining weight, I gained more weight in the area that I got cool sculpting done, which is what they told me was not going to happen. But yeah, so.
Wait, so Dana, what exactly is cool sculpting?
So
what is that procedure?
Cool sculpting, it is supposed to be a non-invasive procedure where it uses cold to destroy fat cells, and then your body's supposed to eliminate the fat cells. We're going to talk so much about how much I'm not a fan of this, but there is a rare occurrence of, it's called paradoxical adipose hyperplasia, which means when you damage the fat cell, instead of it being destroyed and eliminated by your body, it actually grows, and it can become like a lump, an area that just gets bigger and larger, and usually it sticks out more than the rest of your body. It's not good. It's not pretty.
Yeah.
So the complete opposite effect.
The complete opposite.
Baby, so is that what you got the what is it?
Yeah, we all call it PAH from here on out.
Okay, you got the PAH?
Apparently
she got
so.
the PAHs.
No!
So as I've been on my weight loss journey, which I'm not quite where I want to be yet, but as I've lost the weight, I've noticed that, my face is slimming, my chest is slimming, my legs are slimming, even my arms. But the area that I got cool sculpting in was my lower abdomen, and that has just not budged at all.
And Linda Evangelista, that's the former Victoria's Secret model, she had a huge issue with cool sculpting, and it was everywhere. So I had a lot of my followers asking, like, what is this? Is cool sculpting not okay? And I was like, no, let's talk about it.
Well, baby, let's talk about it, because hopefully my viewers know, but they might not, because I don't know. So let's discuss, why should people consider not getting cool sculpting?
So I will say, it has worked for some people, and if it works for you, awesome. I'm so glad for you. For the majority of people, I would say it doesn't work at all, but doesn't necessarily become the PAH. That is rare. But for those people, it is very debilitating, because she's right. It's not going to budge at all. You can lose all the weight, and it'll stay right there. Those fat cells are not going anywhere. What you have to do then is get lipo. I think that cool sculpting is predatory. I think that the way that they phrase everything, like, it's so easy, it's not surgery.
I mean, you hear non-invasive, and you're getting rid of the fat cells. Sign me the up.
Exactly.
Right, it sounds so fun
and
easy and light, but normally, even if it does work for you, you have to do multiple rounds, and it ends up being the same cost of lipo.
I don't really know the price point for liposuction, but I am later going to have a board certified plastic surgeon on who's going to discuss this, and maybe he'll, give us the numbers to see how
Right.
relative it is.
Yep.
Right.
Dr. Rose is actually going to be the one who's going to treat her. So if this
wow.
does happen to you, there is a solution. It is lipo.
So the one thing you could have done,
In the
Yeah,
that was
beginning,
invasive.
done.
yeah,
You
could have
could've
just gone that
done.
route. Yeah.
Oh my
So-
God.
But listen, invasive, that's the gold standard. You're going to get exactly the amount of fat that needs to be removed out from exactly the right places. It's one and done. It's not like you have to do multiple rounds. Listen, baby, invasive,
It's the
and
way
it's
to go.
done, and I'm good.
Get in there, take it out.
Yeah.
All right, we got to talk a little bit more about this. And I know everybody's so curious. Plastic surgery and just, getting to looking good is such a big deal, and so many people want to know more about it. So you stay right there. The conversation continues after the break. Welcome back to the Nightcap. We've been discussing botched procedures, especially when you're trying to look good and feel good and then they go wrong. We've got Jordan Boyd here who's been sharing her experience. And of course, we've got Dana Omari Harrell who's been sharing all her expertise, all her knowledge. Okay, so now we're going to liposuction. And Dana, you're saying you might as well go to the sure thing that is liposuction.
It is the gold standard. That is what we rate everything else on.
What exactly is the liposuction procedure? They're sticking in a big needle and sucking out your
I mean,
fat
it's
cells.
big if you think about it as a needle, but it's actually really small. The incision or the point is like a rubber eraser at the end of a pencil, maybe. I think it's a very easy procedure, but we call it invasive because you literally go inside your body.
to take it out.
Yeah.
And so, Jordan, when you were making the decision, when you were like, man, I am fit, and baby, we see the pictures. You are fit. You look fantastic. And you're like, oh, but I have this little bit that I want to fix. Why did you decide on cool sculpting over liposuction?
So at the time, I was very uninformed about what exactly liposuction was for, who was a good candidate for it. I did not talk to any professionals about my decision. And I always had this idea that liposuction was for someone bigger that wanted to be smaller. Of course, at the time I was super fit. So I was like, I just need something that's going to tweak a little bit. I don't need anything that serious. And liposuction just sounded so serious to me. So
It does sound
that's
so
when I went to
It's
cool
it's the
sculpting.
word invasive
Yeah.
versus non-invasive.
Yeah.
So we say surgery, right? Surgery is
Right.
scary.
Yeah.
It can be for somebody who's fit and just wants to remove.
Yeah, absolutely. I mean, we have literal models that you would think, where are they going to remove anything from? And we find places that they want removed, their fat removed from.
And they get it removed.
Yeah, they do. And they might even move it to somewhere else.
Oh, well, yeah. Everybody want an ass these days. Everybody want an ass, baby. Do people move it to their
Yeah,
breasts
yeah,
too?
they do. I mean, frequently. That's one of the highest growing fields right now, specifically because people are like, we want boobs with natural boobs and small natural boobs. And also, if you're a really small person, you get implants, a lot of times you can see them really bad. So if you get a little bit of fat transfer on top of the implant, it can soften it so we can just see melons stuck on you.
All right, Dana, I know that you analyze all sorts of procedures all day and night. For women, everyday women, I'm not talking celebrities, like Jordan and myself, who, just want to look a certain way and feel like there's a procedure out there for us. What sort of research should we be doing? Who should we be talking to? How do we approach it?
Honestly, the best thing you can do is ask someone that you know who has had whatever procedure that you're looking for done. That's easier said than done because a lot of people are very quiet about it or they don't talk about it, which is why my page exists. But start with, if you know that your friends or family have had something done, ask them, who did they go to? Did they enjoy the experience? What did they like? What did they not like? Look at every before and after that you possibly can from the surgeon. Make sure that they are board certified. And then look for a surgeon who the end results is something that you want. This is everyone says he has the best boobs, he does the best boobs, but if they're not the type of boobs that you're into, don't go to that surgeon, no matter how many people say he's great or she's great. You should also talk to a surgeon who makes you feel seen, heard, doesn't make you feel stupid for any question you ask, and ask as many questions as you need to.
Can you consult with multiple?
Absolutely, you should. You should. Some people are scared of that because they're like, okay, I'm paying $200, $300 for a consultation fee for the doctor's time. But I would rather spend $1,000 going to 5 different surgeons that I'm very interested in, that I've narrowed down, and then pick the perfect one for me, than to just go with one and then maybe have to fix it. Because listen, it is way more expensive to fix a botched surgery than to have the surgery to begin with.
I saw Jordan take that in here.
Yeah,
like,
she said, I
baby,
felt that.
soldier
Yeah,
down,
like,
soldier
down
down.
here.
Listen, Jordan, it's going to be great. Dr. Rose, who I'm speaking to next, is
Yes.
going to take care of you, right, is what I hear?
Yes.
All right, coming up next, we've got Dr. Rose coming on to talk about liposuction, cool sculpting, and more. You stay right there. We'll be right back. Welcome back to the Nightcap. We just heard from a woman who underwent cool sculpting and it didn't go so well, so she's turning to plastic surgery and deciding she should have just done the lipo she didn't think she deserved. So now I've got Dr. Franklin Rose here from Utopia Plastic Surgery and Med Spa to break all this down. How often are you seeing botched procedures in your practice?
Well, I mean, I literally did one today.
Oh,
actually. Just
okay.
finished one a little while ago. We do a lot of revisionary surgery, not necessarily just from cool sculpt. What this patient had is called paradoxical adipose hyperplasia, where there's fat
That
growth.
PAH.
PAH, exactly.
Yeah.
Where there's paradoxical growth of fat after cool sculpt. You know, really, the gold standard for all of this is surgical liposuction, but some patients don't want a surgical procedure. We do something called radio frequency, which is, I think, a little bit better than cool sculpt for those patients that don't want.
Invasive, right?
Right.
Okay, so the radio frequency, like,
Well, it's kind of a heat melting technique, but you don't feel anything, as opposed to cool sculpting, which is cryotherapy or, you know, a cold technique.
so do you highly recommend people stay away from cool sculpting, or are you like, listen, take the gamble if you want?
I think cool sculpting is sort of an antiquated technique.
At this point,
I hope
okay.
I hope the cool sculpting rep isn't listening, but I mean, it's sort of, it was invented maybe, I don't know, 15, 18, 20 years ago, 18 years ago. And I think there's other techniques, non-invasive techniques, that have surpassed it.
Gotcha.
In my own opinion.
And in your opinion, should people just go for the invasive, like Dana was saying? Like, it's the sure thing,
Right.
it's the gold standard, it's what
Right.
everyone wants anyway,
Right.
and what you want is what you can actually get.
Right, but patients sometimes just want lunch hour procedures. Come in during lunch for an hour, lay there, get something done, and go back to work.
Oh, with
So-
liposuction, what's the procedure like?
Oh, well,
or
liposuction, 2-3 days. But again, there's a subset. Look, I've done 4,000 liposuction procedures. It's extraordinarily safe, one of the safest operations we do. But some patients are just afraid of surgery, you know, and so for those patients, less invasive techniques are better.
less invasive is better. And do you offer both in your practice?
Of course, yes.
Oh, okay. So do you have like someone who doesn't have much to lose, like they have like a little tiny pouch? Are you like, maybe we should do like a...
It just depends. If a patient has good skin tone, liposuction, again, is the gold standard. If a patient has loose skin, maybe they need abdominoplasty, a tightening procedure. Or again, if they want just about a 30-40% reduction, what we call radio frequency, Secret RF is a very good technique, or True Sculpt is a very good technique.
Are there any side effects like PAH to the radio frequency or to liposuction?
Not that we've seen. I mean, it's very rarely reported. I mean, paradoxical hyperplasia with Cool Sculpt, it still only maybe accounts 1%, 2%, 3%, but it's reported in the literature.
Got you. Okay, so then let's talk about cost, right? Because I feel like that's another reason that some women and men might hold back from going with what we call an invasive procedure like liposuction and might go to a cool sculpting instead. But do you feel like they're a relative?
Well, I think in the sense, liposuction, you're going to have anesthesia, operating room fees, surgeon's fees, so it's going to be more expensive than a less invasive technique, but it's going to just simply wipe out all of the fat. I mean, it gets rid of all of the fat permanently. That's the beauty of liposuction, is we're all born with a certain number of fat cells, And in weight gain, these fat cells can enlarge. In weight loss, they shrink, but you still have the fat cells. What liposuction does is permanently rid the body of numbers of fat cells.
Okay, so that is one of the concerns that I've heard from some women, so I hope you can clarify this for me. It's like when you get the fat cells removed,
it doesn't come back anywhere
it
else.
It
doesn't
come back anywhere else? No?
No, it does not. That's been studied in the Scandinavian plastic surgery literature. It does not come back anywhere else.
Oh, okay. So, but when you gain weight, it won't come back there. It'll just come back somewhere.
No, when you gain weight, it'll still be evenly distributed where you would gain the weight, but it's not going to all of a sudden bulk
I'm
up.
not just going to have a huge lump on my bicep because I removed it from my stomach.
Correct.
Oh, okay. So for people at home who are kind of like flirting with the idea of potentially, you know, losing a fat cell here or there, what should they do?
Well, I mean, the real key is to see a board-certified plastic surgeon, somebody who's done a number of these procedures, and then just have a candid discussion. Make sure that there's various options available. There's different kinds of liposections. You have to be really careful in the arena of plastic surgery because there's med spas everywhere. There's so-called cosmetic surgeons that are not board-certified plastic surgeons. It's just, you have to exercise great caution when choosing a plastic surgeon. The patient does.
Well, thank you so much for coming on and sharing your expertise, Dr. Rose.
Thank you.
All right, coming up next, guess who's back in the building? My girl, Veronica! We're going to be trying Tab's new wine. You stay right there. We'll be right back. Welcome back to the Nightcap. I'm behind the bar because my girl Veronica's in the building. And it's time for V-Cans! V-Cans! Woohoo!
Let's get into it, as Tab says.
Yes!
Hey, so Carolina.
Talk to me, baby.
Carolina Sanchez.
Oh.
I brought something really good. Tabitha Brown wine. Baby, she dropped it this year, and I said I had to try it. Now, let me tell you how I came about getting this wine.
Oh.
So for my birthday this year, my beautiful niece, shout out to you, Yvette, Annie loves you. I had requested someone give me some Tab Brown goods. So my niece got me this wine. I'm so excited for my birthday. And she was asking me, Auntie, have you tried the wine that I got you for your birthday? I was like, I want to try it on the Nightcap. Woo woo, with my girl Carolina. So here we are.
Let's do it.
So we have two wines, right? Love Y'all is one of them. It's Moscato. Love Y'all. That's one of her favorite sayings, y'all. Love Y'all. And we love y'all here at the Nightcap, by the way. And then we have Hello There, which is a red wine blend. All right, so let's get into these two wine flavors.
All right, pull me up, girl, pull me up.
So we're gonna try the Moscato wine first. And y'all know Moscato tends to be what? Sweet.
Very sweet.
And I love sweets because I'm Sweet V. Yes,
I'm
darling.
I'm not.
Oh, yeah. Yeah, you spicy. I think the red wine blend would suit you best.
Yes, Moscato,
Oh,
listen,
pretty
I recommend
color.
anyone who's never actually tried wine and thinks that they don't like it,
Right.
to begin with a Moscato.
Moscato.
It's a
I
great
agree.
introductory wine.
It is.
It's how I started, baby, me and Barefoot. We used to clip.
Ooh.
But now,
Cheers.
all right, cheers. Let's see.
All right.
Let's see. This
Loving
is
the
Love
color
Y'all.
and the smell
The
smells
smell.
like Moscato. Very sweet. Had peaches in it and everything. Okay. Veronica for the Moscato, baby. It's
I
the
knew
wind
it.
is sweet, tastes like peaches, as the bottle label indicates, and
okay,
it is delicious. And we have it chilled, so I can really taste those flavors pumping through.
So, we knew I am not a sweet wine kind of girl.
I
I would
know.
never drink the Solo Dolo,
Yeah.
but I could make a white sangria with this.
Yes.
Easily.
Ooh, a
Easily.
good nice mix
Or
with it.
turn
I
it
love
into
that.
a Bellini of some sort with some sort of topper.
Yeah. Tabitha Brown wine Moscato, it's a win. All right.
All right, let's see if no, which one is it?
Which one? This one?
The red
okay,
one.
the
The
red
red
one
one.
is
Hello there.
Hello there. Now I have a vision. This is for a date night.
Oh.
This is for the night with your partner.
Ooh.
Where y'all just get together, have some chocolate, have some strawberries, and some red wine.
Hello there.
Hello
Oh,
there.
You're saying hello there to your partner.
Exactly,
Like you guys
hello
haven't
there.
mingled in a minute because
Yes.
the baby's been driving y'all crazy.
That's right. And you just say, hello there. I have something for us tonight, dear.
Awesome.
A little lingerie.
Ooh.
Oh, hey.
Hello
Hello there.
there.
Cheers on that. Oh, let me smell it. Mmm. See, I am a sweet drinker. This is not sweet, but I knew it. I already knew what I was in for when it said red wine blend. I was like, I know it's gonna be very probably dry, kind of have a tart taste to it, which is okay for someone who likes it. I am not a, tart drinker. I'm a sweet drinker because I'm sweet V.
Yeah.
Right?
And I
So-
am. Carolina absolutely can. Ladies and gentlemen, this is for me.
Verona can't only because I don't like dry tart wine.
Yeah.
But it's good for someone
No,
who
it
does.
is absolutely fantastic. I love the oakiness of it. It
Yeah.
comes all the way through. This is
Ooh.
Carolina's type of wine.
Gotcha.
Auntie Tab knows what she's doing.
Auntie Tab, now listen, you the vegan queen. So we have a segment called Midnight Munchies. We want you to come on the show and mix up a nice veggie dish for
Talk
us.
to her.
Vegan
Let her
dish.
know. Let her know.
Vegan dish, okay? Let me know now. Auntie Tab. And you know she replied to me on Instagram.
So come on through, Auntie Tab. All right. Y'all go get her wine, though.
It's in Target. Go. Now. Tag me. Let me know. What are your thoughts?
Cheers. I'll see you guys next time.
Bye.